So, couple of things. I know that you have done so much of the clinical research work on artificial intelligence, on genetic expression profiling, and a whole bunch of different things. But let's start with the basics. What do you do? Talk to us a little bit about, what is your clinic like, and how do you take care of high risk melanoma patients?
Yeah, so my melanoma patients kind of run the gamut from people who may have been recently diagnosed with melanoma and they want to know more about the disease. They want to understand what's their treatment plan, who's going to be on their treatment team, what's their follow-up plan, to maybe people who have had one or more melanomas in the past and their big concern is, am I going to get another one? And if I do, can I make sure I find it early? They're very in tune with the fact that early detection is important for melanoma. To maybe patients who are at high risk. Maybe they know genetically that they're at risk of getting melanoma, or they have a strong family history, or they've had a lot of sun damage and other kinds of cancer. So those are kind of the types of patients that I see. Most people are getting regular screening, so full body skin exams, with or without the use of things like digital imaging, like mole mapping. I say I can't. I'm totally incapable of seeing patients without my dermatoscope now. You probably feel the same way.
Me
Um,
too. Me too. Whenever, like, when I run out of battery, I was like, "Excuse me, I have to go get my scope charged." But yeah.
Exactly, exactly. So we use dermoscopy regularly on all of our patients. I think it's a really great tool to help us, make more informed decisions about what lesions are concerning and which ones are not. So everybody's generally getting full skin checks routinely at their visits and with dermoscopy. And then if they have, for example, a lot of atypical nevi, we'll do things like digital mole mapping where we follow and look for, if a lesion is concerning to me, I can see, is that a new lesion? Is it a changed lesion? And then also some things like serial imaging. So maybe somebody has a mole that they're worried about and I'm not as worried about, and we may put in a picture in their chart of that mole along with a dermatoscopic image so we can see them back.
Yeah, it's really interesting that you see the consistency, like what you do, what I do, and also like some of the other folks that I've interviewed, and we all sort of use that whole series of approach, right? I mean, I think you mentioned one aspect of it that is early detection, but I think another aspect of it is that you want to avoid unnecessary biopsy, right? And I think that is a one thing that most patients sort of complain about, and most patients just so afraid when they go into the dermatologist office sometimes.
I agree. So I think, one of my most important, I think one of the things that makes us experts is that we are able to make good clinical decisions. We're not just taking everything off. And so a lot of our patients will come to us and they'll say, well, I've had 25 biopsies in the
Sure.
past 3 years. So, my goal is to not miss somebody's melanoma, but to do it without just taking off 3 moles at every single visit. And so I think that takes a lot of experience, a discerning eye, a close relationship with patients, that if we don't take it off now, if you notice that this changes in 3 months, you can reach out to me. I'll get you in and we'll take a look. So it's not a one chance and you're done. Kind of relationship that I have with my patients, and then that's where I think, as dermatologists, potentially using technology to help us make better biopsy decisions comes into play too.
Yeah, we're going to get into that. We're definitely going to get into that. So I think there's a couple of key points that you touched upon, right? And I do the same. That is, you want to form some sort of a trust relationship so that that patient is coming back. They're not going to lose through follow-up, number one. And second thing is, I tend not to monitor any nodular lesion, because if you miss those can be really dangerous, right? And
Right.
definitely. And a couple other things.